Hi, and good afternoon, everyone. My name is Dr. Raquel Romero, and I'm going to be the facilitator for the ECHO session today. Thank you so much for making the time and effort to join us in our session Communicating with Confianza, a Health Literacy ECHO. This ECHO is brought to you by the Health Confianza team in collaboration with UT Health San Antonio Super Hub, the YWCA, South Central EHEC, and the University of Texas at Austin. For those that are unfamiliar with who we are, Health Confianza is a community-wide health literacy program that aims to provide health literacy education, training, resources, and workforce development for Bejar County and the surrounding areas. Our team believes that health literacy is critical to transform health and achieve equity for all. The sessions build upon each other, so we highly encourage and invite you to attend every single session for enhance your holistic learning experience. The second part of the ECHOs is devoted to a dynamic discussion related to a real life scenario presented by a member of our community. So I invite you to think about a case that you can present here in these sessions. But to ensure privacy, please note that no personal health information is allowed to be shared at any point during discussion of this session. And what is personal health information? That includes DOBs, date of birth, addresses, appointments, etc. So before we go to the introduction of our team, I would like to ask if you please enter your first name and your last name in the chat. This is to for our attendance records. You can also include your affiliation and email addresses. And we encourage to join us by video if you feel comfortable and you can join us, particularly in the discussion part of the video. You are more than welcome. We would like to see your faces. If you have any issue with the connection, and my apologies, my allergies are not very good today. So if you have any issue with the connection, please, you can send a message to the ECHO IT for assistance. So I would like to now go to the introductions. So I would like to start with our hub team, Dr. Adelita Cantu.
Yes, good afternoon, everyone. My name is Adelita Cantu. I'm a professor at UT San Antonio School of Nursing and working with the Health Confianza team now for a few years. And I apologize, I did something to my camera, so I cannot get the video to work. So I do apologize for that, but welcome everybody. Thank you for joining us.
But we can see your beautiful face, so you're doing something definitely
right. I did something, I apologize.
You look very good. We have Dr. Stone, who also presents a case for today.
Hi, everyone. Good to see you all. Many returning faces here today. I am Melanie Stone. I'm a faculty at UT San Antonio in our schools of medicine and public health, and I co-direct Health Confianza, and I look forward to speaking with you all in a few minutes.
Thank you very much. Corinne Reyes.
Hi guys, Corinne Reyes. I'm here with YWCA San Antonio and also a member of several different Health Confianza programs as well, and happy to be here with you guys today. I see a lot of great names in the chat here, and hi Dr. Wood, I'm glad you're here to join us.
Yeah, thank you very much, and thank you for everyone who joined our session. Dr. Rosenfeld.
Hey everyone, this is Jason Rosenfeld, Associate Professor in the Department of Medicine at UT San Antonio and co-director of the Health Confianza program with Dr. Stone. Good to see you all.
Thank you very much, and Dr. Rosenfeld is going to be our lead specialist for today. And we have Dr. Teresa Wagner, who is our didactic presenter.
Hi, everyone. It's great to be here. I am Dr. Teresa Wagner. I'm an associate professor at UNT Health in Fort Worth and director of our Community Health Worker Training Center.
Thank you very much. And just would like to say that finally, ECHO is all teach on learn environment, so we encourage everyone to participate in our conversation today. And again, please just join us by video, and howdy says in the chat. I need to say howdy too. And thank you so much. And now, with no more from my end, I would like to move from the didactics, Dr. Wagner, on your time. Thank you so much.
Thank you. I forgot to mention that I'm also a mentor for Health Confianza for the last, I think, 3 years, Melanie? No, 2 years. But anyway, it's been a great experience and loved seeing the program that Melanie and Jason developed together. So I am assuming everyone can see my slides.
Yes, perfectly.
Okay. All right. Well, today we'll be talking about advocating for health literacy. And of course, when we do so, it needs to be evidence-based. So how do we take or find evidence, or how do we find the gap to advocate for? Because that has to be the foundation for anything we do in advocacy. So today's objectives is that we will define and discuss advocacy through a health literacy lens, apply advocacy principles through the journey of health literacy advocacy in Texas, and examine advocacy actions and idea starters for your own efforts. So let's start with just defining what is advocacy. It's actually a strategic approach to influencing outcomes and driving change on behalf of your community. So it doesn't mean that it has to only be at the state level or the government level, but it needs to be at the level where that change needs to happen. And we'll talk more about what that means in just a minute. But basically what you're doing is representing your community's rights and needs to the level of government or leadership that's best able to respond to that particular need. So health literacy advocacy then involves actively supporting and promoting health literacy through policy change, community engagement, and education. So the key components of health literacy advocacy would be that we want to raise awareness about the importance of health literacy. And I know Melanie and I have been involved in those efforts for probably 12, 13 years or more. We want to create accessible and culturally relevant health resources so that people can understand and use that information to stay healthy and well, or to make appropriate or well-informed decisions for themselves and those that they care for. And we want to collaborate with healthcare providers, policymakers, and community organizations so that we build a culture of health literacy, not only in our communities, but throughout our state, hopefully. So when we look at the state of Texas, and this is the health literacy data map that was designed by UNC Chapel Hill, and you can see that where they've kind of heat mapped, and this is old data. We've not had another study since the time that this took place, which was probably about 2005, 2003. But still, it gives us a picture, and we know that actually things have probably gotten worse and not better just because of more population and perhaps population shifts. But you can see the more red is the lower health literacy, and then the orange is the next level up, and our state is almost completely red and orange except for in those more heavily populated urban areas. So that's a problem because it means that there are lack of equity in a lot of our rural communities, and also communities that tend to be underserved. So the process of advocacy is working with and or on behalf of groups, communities, states, or countries, and we want them to obtain services or resources that would not otherwise be provided, modify existent policies, procedures, or practices that may have adverse impacts or that may not be addressing the issues at hand, maintain existent policies and procedures or practices if they're in threat of being taken away, modified, or changed in a non-beneficial way, or promote new legislation or policies that will result in needed resources or services. So first, we have to figure out what's the problem, what's the discrepancy. And we know that we need to find that and look at what is or what's existing, and then compare that to what should be for that particular topic, population, whatever it is that we're finding that discrepancy in. And so if it's policy, then we need a course of action chosen by public authorities to address that given problem or gap. And then we need to make policies and using those authorities. And a lot of the times, many of us work in positions where we can't lobby, so we have to advocate and we have to educate. And so that's, and working for a university like I do, and Melanie and Jason do, we educate legislators. And so, using that evidence base that we find as we're examining the gap or the discrepancy, to go in front of the legislators and educate them, either through testifying or just meeting with their staffers and letting them know the facts behind the changes or issues that need to be addressed. So basically the steps are, then you identify the problem, explore solutions, agree on a solution, bring research and prepare for a debate or presentation, practice, of course, we always practice before we present, and then take action. And then once you've delivered that presentation, speech, testimony, reflect on how it turned out, how you felt about it, whether you feel like your point got across. And I know I've testified 5 times over the last 10 years, and every time you're like, wow, I could have done that better, or frustrated by the situation at hand because you can't really control anything. But you just have to be as prepared as possible and have your facts ready to go. So the health literacy problem then, if we were to define that, is that it's not mandated in the state of Texas, nor many states across our country, and thus why we have the U.S. Health Literacy Association and experts across the country that come together. In fact, we're having the Health Literacy Collaborative Summit, which is a nationwide health literacy summit, next week here on my campus. So there'll be people coming in from all over. There's competing priorities in healthcare, and health literacy falls between the cracks because it's not required, and they have so many other things that are required that they have to keep up with. There is a lack of place to gain education on health literacy skills in Texas. That's why I founded my health literacy lab, and as a result, have multiple interns. I hope to someday have fellowships where postdocs can come study. There's no reimbursement for services in health literacy, so we always have to find some type of sustainable model. And I had to create my position here at the university in order to have a salary and be able to advocate for and do health literacy work at the same time. But that took a lot of proving that it was an important issue and a lot of advocacy. It's difficult to retain health literacy staff in the healthcare setting because it's not required. And so it's usually just a small piece of someone's position. And the first time something else becomes more important, those people are let go, or their job is reassigned and they are no longer there to drive the culture. So we need advocacy efforts to drive change. And the U.S. Health Literacy Association, actually, that's their entire mission, is advocacy. So it's good that we're finally bringing that to a national organization within our country. So these are the different branches of the U.S. government. And so we know, obviously, that we need to advocate in the legislative area in order to make any changes in laws or legislation. And so we also can, on a local level, identify decision makers, whether that's elected officials or community leaders that can help us. And so you can see that there are different public policy makers at different levels. So executive level, which would be president, vice president, et cetera, on a federal level. But then the states have, the governors, lieutenant governor. And so you just go down the line and decide, where is my issue? Is it local? Is it state? is it federal, and then move forward knowing what level you need to target in order to make the change that is needed to be changed. And then there's also nonprofits and for-profits. So there's organizational policy. So it could be that, you know of a particular nonprofit that is doing some type of work, but you feel like if they could help in this other area, that might, bring change to your specific cause. And so you might approach that nonprofit, and if doing so, you would have to probably, gain the trust of a staff person or meet with their CEO or their executive director, so you find that person that can help champion whatever your issue is. But on the state level, it all starts with a bill. And I'm sure many of you have seen these cartoons before, and they're hilarious, but that's where we start. And so I've helped write bills several times within our legislature, but not actually writing them myself, but educating the legislator who is writing the bill or their staffer who is writing the bill, and bringing evidence or sending them evidence through email that they then build that around. But there's two different sides. There's the House and the Senate, and we have to make it through both in order for something to become law. And then we have to make it through the governor as well. And so far, our health literacy bills have been pretty successful in the House. If we've made it to the floor debate twice now and come out of the floor, but it can't get past the Senate committee because of it's been politicized, and it has never made it out of the Senate committee, and it has to pass both, and then the time expires and then it doesn't get passed. So basically, in order for a bill to become a law, we, bring together this group of concerned citizens, whoever, organization, et cetera, and brings attention to the legislative representative. And there's been a lot of organizations that have supported health literacy, Methodist Healthcare Ministries, myself, we had Health Literacy Texas for a while, the Texas Public Health Association. So Melanie has helped with advocacy. So a lot of different people and groups come together. The bill's written and submitted by the clerk, and then it has to be sponsored by at least one legislative member in the House or Senate, or both. And so far, we've had good sponsorship. We just can't get it through that Senate committee. So as you see, it is referred to committee, then they hear testimony, and then if potentially they were to be close to accepting it, but they just didn't like the language, then it goes back for revision, and then it has to go back to committee vote. The times I've seen it, I think it's only had to be revised in one session. The rest of the time it has been fine, but it just doesn't, again, get through the Senate. So approved bills go for the full membership debate. And like I said, that has happened in the House twice, but it never has passed and never gotten to the governor's desk. And at that point, the governor can either sign it, veto it, or let it sit on his desk. And if it's still sitting there at the end of session, it comes law automatically, but that way they don't have their name on it in case at some point it becomes politicized. They didn't actually sign it into law. But I use this picture as the last slide because after a day in the legislative session, this is what you feel like, because it's pretty exhausting, and trying to, advocate for your point is pretty hard. So again, this is what the governor can either sign it into law, veto it, or take no action. So this has been the Texas state health literacy legislation throughout. The 89th session was pretty much the same as the 88th session last year, 2025. But you can see that was relating to requiring a statewide health coordinating council and state health plan to examine and report on the impact of low health literacy. And I was like, that's a waste of 2 years. We already know it's a problem. And you saw it on that map that I showed you. So the next year we luckily got it to just, okay, we're going to send it straight to a health literacy committee. And so that's when we developed Health Literacy Texas. Was we were hoping that if it passed, that it would come straight to Health Literacy Texas and we would be there ready to act on it. But after 2 or 3 years of keeping Health Literacy Texas going and it not passing, then we partnered with Texas Public Health Association and to make it more sustainable. And I'll talk about that in just a minute. But we do have a Texas State Health Coordinating Council, and they develop a state health plan, which not a lot of people know. But they did hear the testimony the first year and then wrote it into the state health plan, but that expired in 2020. It was pretty comprehensive in that plan. Unfortunately, that went away when it expired. And now this is what the State Health Coordinating Council does. But basically, what we're trying to do, but just it doesn't have, the health literacy specificity or, that mandate behind it. This is just kind of overarching what we should be doing, but there's no mandate behind it. So we want to make sure that all of our future generations are healthy. So this is what it stands at now in the state health plan for until 2028. But basically supporting health literacy for those who are Medicaid recipients, which, I guess that's focused on because many times they tend to have low literacy in general or be lower education, low income, all the high risk things for low health literacy if they're on Medicaid, lack of employment, etc. And so then also they added in high school students are educated about the healthcare system and careers in healthcare, which I think is happening, but I would have liked to have seen this say that they would be educated on health literacy, specifically in how to care for their own health. Although I think that is coming with some of the legislation that was passed federally and then also in our state where now they are mandating health education or nutrition education 6th through 12th grade. So what can you do? You're like, wow, this is all great, but I'm just one drop in the bucket. Well, you can do a lot because I was just one drop in the bucket when I got into this. And, when you combine a lot of drops together, you can make a difference. So present your ideas at public meetings, write letters to the editor of newspapers, magazines, scientific journals. We've done all this, Melanie and I and others. Write letters to your local, state, and federal legislators, make phone calls, send emails, conduct a public forum on the issue. We've had multiple health literacy conferences and summits here in Texas. And we've brought national ones here to Texas as well. You can become directly involved if you don't work for the government, run for political office, collect petition signatures to send to your legislators. And this is just an example of an op-ed that Melanie and I wrote after the session in 2021 because we were frustrated and saying, it's time for health literacy law in Texas because we'd been fighting for it for, I think, 2 sessions at that point. And then here is the second one that I just wrote this year with Melanie that was in the San Antonio Express News, just talking about the health literacy crisis contributing to the public health crisis in our state. So testifying that, I've done that as well. Providing technical information to policymakers to help write legislation, building coalitions and networks and other alliances. We've done that, or joining with smaller groups to influence the political system, joining with Texas Public Health Association. And this is a policy resolution I wrote with them in 2021. that basically talks about the issue of the lack of health literacy and how low health literacy impacts our state, and the cost of low health literacy, et cetera. And then other things you can do, join an interest group. I know I'm a registered dietitian, and we have a PAC, a political action committee, that goes, and generally we, are advocating to keep registered dietitians in our state, because they used to sunset review us every 2 years, I think it was. But now we've been moved into a different category, so that doesn't happen. But there could be other issues that we do go advocate on. I just haven't done that lately. So, joining together with others. So, and then knowing when you need to adapt is always key when you're advocating for anything. So when we knew that the legislation probably wasn't going to pass, and it was difficult keeping Health Literacy Texas afloat, because we were all volunteers, and all of our jobs, as you probably all know, were getting busier and busier. We partnered with TPHA and folded into their policy and advocacy committee in order to keep it sustainable, because TPHA gets funding through our memberships and things like that, and has an executive director to run everything, and she's paid. So, there's not that whole it's all volunteer issue. So collaborating with them, we developed a one-pager that we handed out at various conferences and other educational opportunities where we could, and still do. Every year I do the Health Literacy Month proclamation with the governor's office. I skipped 20 and 21 because we were in the middle of a pandemic. I figured he was probably kind of busy, but I've had it every year since, and then this past year. So connect regionally. So the summit that we'll hold this year, next week here on campus, is the result of several states coming together and saying, hey, we're all having these different health literacy conferences. Why don't we join together and just have one big one versus competing for each other's attendees? So that's what's happening here. But it's really brought together, this core group around the issue of health literacy in the U.S. And we partner and work with, in various different ways, the Institute for Healthcare Advancement in California, and then the director of Marilyn Horowitz Center is going to be here this week. We have international people coming that I met through the International Health Literacy Association. So it's just a great way to bring together all the great minds in health literacy and make sure everybody's, working together. And again, connecting nationally, this is a health literacy press conference that we had a couple years ago that was quite informative. I just actually had my students, because I got to develop and am teaching my health literacy course here at UNT Health, and we were talking about advocacy, so I had them watch the press conference. It's actually really good. So if you ever want it, it's online through the Institute for Healthcare Advancement, and it was a great, again, way to connect. There's the International Health Literacy Association. I was on the executive board for about 6 years, and they are still alive and well. This is a story where we went to the actual summit a couple of years ago, and just a good way to connect internationally and present our research and advocate for health literacy on a global perspective. And we were talking about this in class the other day. Like, it was really interesting to me, because when they watched the press conference, they were like, it's so interesting that it's the same problem in all the states. I was like, it was interesting to me that it's the same problem in all the countries. But to summarize, to drive the health literacy culture in Texas, join forces, publish op-eds, seek research opportunities, educate legislators and provide expert testimony, champion advocacy efforts to drive change, connect the dots to patient safety and achievement of the quintuple aim, which if you're not familiar with that, you might look it up, but it's to reduce costs, improve patient experience and outcomes, improve population health, health equity, and improve clinician experience and satisfaction, which all of those things are needed to make our healthcare system more efficient and more health literate. And then network and support others regionally, nationally, and internationally to drive recognition and change. And that is all for me. I will stop and see if anyone has questions or if there's any in the chat.
Thank you so much, Dr. Warner. This is very good and very important information, and congratulations for all the work that you have been doing. It is wonderful. It is huge. That all the things that you've been doing for achieve this health literacy. Thank you so much. Is there any question from Dr. Adelita Cantu?
Thank you so much. And I do have my camera working now, so I'm able to see everyone as well as everybody see me. I was really intrigued by your section on the schools now being mandated to include at least some health education. And I was wondering if you have any specifics on that in terms of, there are going to be expectations of teachers. So are they going to need to be educated in some way?
Yeah.
And is that going to be for a semester long, or is it just going to be considered like for 1 week and then that will be it? So I was wondering if you had any specifics on that. Thank you.
I don't. I do know that we have been in conversations with I can't think of the name of it, but it's a college in San Antonio, and they partner with some high schools that is potentially adopting my teen lifestyle medicine micro credential. And they were asking us about like, how do we spread this out for the semester? And so I think we'll probably have to enhance that some, because I think it needs to be a little more comprehensive. Did we lose her?
No, I'm here.
Oh, okay. Yeah, okay.
Yeah, no, I'm here.
But interestingly, I'm now working across the country with, this micro credential I created is based on lifestyle medicine, the 6 pillars of lifestyle medicine. So that's sleep, substance avoidance, social connectedness, stress management, physical activity, and nutrition. And I have, when working with a couple teams that I developed it with, and with the past president of ACLM, the American College of Lifestyle Medicine, and they have developed clubs within high schools across the country. And so we're looking at trying to extend that. But again, I think to meet the needs here in Texas, we're going to have to expand the nutrition part. Luckily, I'm a registered dietitian. So we'll see what comes, but we're excited about the opportunity.
Yeah, I was very pleased to hear that. So thank you for letting us know.
Yeah.
Yeah, very important. I also took my notes on that, because it says high school students are educated about the healthcare system and careers in the healthcare, right?
Yeah. Yeah, we actually have partnered with one of the high schools here locally to provide the community health worker certification in their high school by mentoring one of their trade teachers. They have the various trades in the schools that students can choose versus college or before college. So yeah, they're really expanding those healthcare careers that are available in high schools. Melanie?
Yeah, that's very, very good. Kendra Lee?
Oh.
Carpenter, I think, is another hands up.
Sorry, I'm trying. Hi. So, yeah, we work really closely with Sam Houston High School, and for the last 3 years that we've been working with them, they have a lab right there where they do phlebotomy and everything in their classroom. I don't know if they do CHW certification. I don't think that they do that. But anyways, my question was more about the passing of the bills. you kept on mentioning that once it gets to the Senate floor, that it becomes quote unquote politicized. What do you exactly mean by that? What about it is politicized that is making it not being able to be passed? And do you have empirical data that shows that this is people not being health literate is obviously costing our systems a ton of money? Because I think that that would be a really driving factor to these people in passing this legislation. That I guess it's a two-part question.
Yeah, and there's not an easy answer because there is some literature out there about the high cost of low health literacy. However, not a lot has been done recently. But there have been, studies here and there. So we always present that when we're testifying or educating the legislators. The political part to it is, if you think about it, a lot of people make money when people are sick. And so, whether or not they want to pass legislation that resolves that issue is a whole other question. It's also been kind of posed as an attempt to expand Medicaid in our state. So of course that makes it politically charged. So, you just can't control all of those factors, no matter how much you educate. If someone doesn't want it to pass for their own agenda, then it's not going to pass, depending on who's in power.
Understood. I just wanted to get a clear idea of what those barriers were. Thank you so much, and thank you for your work and your presentation.
Sure. Yeah.
Thank you, Sandra, for your question, and Dr. Wagner for all the answers that you've been providing to all of us. Dr. Stone?
Yes, hi. Great presentation, Teresa. She always does a good job with this. I have a comment and then a question. So my comment is for the group. So this is what I hear from legislators when we talk about advocacy. And this pertains to any issue. It's not just specific to health literacy. So whatever issue you are advocating for, what they want to hear, let's just, say, for example, our state legislators, what they want to hear are your stories. So many of you are out in the field, you're interacting with community members, patients on a daily basis, and you have like really profound stories to share. When they're sitting in Austin, they don't have any idea. They're not out there in the field. And so what you can offer them are these stories, because one of their mindsets is even though they're for the state of Texas, they're very hyper-focused on their particular region where they have their constituency. So they want to know in that constituency that people are having these issues, because it's easy to say, oh, well, that's a rural Texas issue or that's a West Texas issue. So point being, you have the stories, you have the power to share that, and that can really go a long way for advocacy. My question is for Teresa on just to kind of clarify. So we never got a health literacy bill passed, so there was never a bill. We did get it into our state health plan for a couple of years, right? Mm-hmm. But my understanding of that plan, it's really just a document for recommendations, but there's no actions on it. Is that correct? Like, so,
yeah.
It's nice to cite it, but like there's no meat in terms of
correct
anyone in the, state funding it or doing anything about it. So what is your best advice for us, to these state health coordinating council members? These are governor appointed members. Any thoughts on how we can get something that's got a little more, meat to it?
Well, I mean, obviously building relationship with those members of that panel would be good. Again, it just would depend on how strong of advocates they are. Mm-hmm. But I think, it's always good to start at a grassroots level, because if you can start little fires, all over Texas, then maybe it will come to fruition. But I think just keep talking about it, keep advocating, keep doing all the things that we're doing, keep publishing papers, keep, you know, all the stuff. Because if we stop, then it just goes away, right? And that's actually how I got into health literacy, was just, I kept talking, and finally Methodist Healthcare Ministries was like, are you going to come testify? And I was like, oh, I thought y'all were sick of me. So, yeah, I just keep at it. That's, you know, what we have to do.
Thank you so much, and keep sharing the stories, right? Just to keep learning from all of us, and maintain the motivation, and just keep working.
Yeah, and
right?
both of those op-eds that Melanie and I wrote have stories in there about issues. So you always use the stories, because those, like she said, are what they want to hear, is real life. You know, how is it impacting people's lives and their constituents' lives?
Yeah, because you put a person in the story, so this is real. It's not on just on the desk. It's not in a book, but it is real. This is happening. Well, actually, that is a very good connection now with Dr. Stone, who is going to present the case. Dr. Marison, on your time.
Oh, sorry, I've had a little trouble hearing. Are we moving on to the case?
Yes,
Okay.
moving on to the case.
Awesome.
I'm going to use that connection for the case.
Oh, no, that's fine. So yeah, you know, if you have been joining our Health Literacy Echo, you know, fall, spring sessions that we've had, we always end our session with someone presenting a case, which is basically a story like we're talking about today. And for today, we're going to do it a little bit differently, because kind of in the spirit of advocacy, I want to give you a resource that's accessible to all of you. So I am actually putting both of the links into chat right now, and then I'm going to share my screen and explain what it is. Okay, so let me make sure I can. Okay, are you able to see my screen?
Scenarios for success in patient communication.
So let me give you some background. You know, I've been involved in the health literacy field here in San Antonio specifically since, gosh, I think 2007. And in the early days, we had a coalition, a San Antonio Health Literacy Initiative, which included many of our hospital systems, including University Health System. So Luz and David were, you know, friends and colleagues at University Health, who took some action on, they were really trying to make some change at University Health System. So, you know, this is kind of going into our organizational health literacy, which we'll talk about next time. But they wanted to create opportunities to educate their staff and their clinical staff and their other staff on what health literacy training could look like. And so they called it Scenarios for Success in Patient Communication, and that's very intentional. If you think about it, a lot of times health literacy is about the negative. It's like, oh, these people that we're working with, they don't understand. We have to help them understand. It's kind of unfortunately, it's kind of like a deficiency mindset. And so they flip that around and are making you think, well, what can we do? What is our obligation to make it a successful environment for that patient to navigate the healthcare system? So there's two of these books. They used to be printed books. I guess they are now mainly online. And what they have in here are scenarios that you are free to use. These are all based on actual patient encounters that they have had in their health system. I mean, obviously, names and specifics have been changed, but they are all real based scenarios. And then they have some questions that your training team can discuss. So like this first one, this first booklet is general health literacy. It's going to cover all sorts of things. I know I'm scrolling through it fast, but just wanted you to see that there's a lot of scenarios. And then they created a second one specific to diabetes. I think they may have gotten actually funding, a diabetes grant fund to do this one, but these are all scenarios that have something to do with patients and community members struggling with diabetes, which of course is very relevant for our community. And so I'm going to take you through one or two of these just to kind of help you, think about how you might use it in your organization. Maybe you want to do some teaching of your organizational team. Maybe you want to also use it for advocacy. Maybe you want to try to get your health system to start putting resources towards health literacy. By making health literacy, which is an abstract term, more specific by using examples and storytelling, obviously can help. So let's go through this first one here. And I'm not sure, I'm going to mispronounce his name. Mr. Rubaduka had been given a prescription for suppositories and had been told by the LVN to read the directions. During the follow-up appointment, the LVN asked Mr. Rubaduka, sorry, like totally butchering that, how he felt. He told the nurse that his anal area hurt because it was difficult putting in the suppository. He could not read the directions and had inserted the suppository without removing the foil, resulting, after all, in the need for a colonoscopy. Okay, so let's, answer these questions. Would it be helpful to, I guess we can just all see it here on the screen. How could that team have explained to him in simple terms the correct use of the suppository? So this is going back to some of our foundational health literacy skills of plain language and other techniques. How would anyone want to take a stab on how, instead of just telling him, go home, read the directions on the package, and, expecting him to be able to do that, how would you instead be able to explain it to him? Or any techniques that you might have used?
Yeah, I want to say that you can unmute yourself, or you can even put in the chat, and we promise to read those comments.
And while you're thinking about that, I think when you do a job day in and day out, like this LVN does, you have kind of blinders on, right? So you don't necessarily think about how someone who is not familiar with that topic would understand how to do that, because you're so used to it, you do it all the time, you are in that world. It's true in healthcare, and it's true in any other world, if same in the automotive world or any other world. Yeah, so, it's a reminder that we all need to be thinking, each person in front of you is unique, and they have different backgrounds, they have different ways of comprehending information.
Yeah, I think, Kendra, I think I saw you unmuted for a second. Did you have a comment?
So I guess I wanted to ask Melanie the question. What was your question one more time, Melanie? Because I didn't understand it. I apologize.
Oh, no, that's fine. What would you have done differently from what this LVN did? So what if you had Mr. R in front of you, what would you have done instead?
Before or after his issue?
Before, when you still had him in the clinic.
Mm-hmm.
So before I sent him home with the medicine, I would have definitely asked him if he was familiar with ever using a suppository. And if he wasn't, I would have explained to him how to use the medicine. Do you want me to go into the full explanation?
No, you don't have to do that. I'm just looking for techniques here.
Well, I would, tell him to use it in the bathroom, sitting on the toilet. Maybe use Vaseline, definitely to remove the packaging before that, and to be comfortable. upon insertion of a suppository. So that's what I would have done. But I think it's super important to realize that most people have never used the medicine that they're being prescribed, and that they would probably need a little bit of guidance, and especially when it's a medicine that requires a special type of way to be a delivery than most typical medicine.
Thank you. Thank you very much. Right, Dr. Stone, is like, for many people may not be familiar with even the terminology, right? And how that's being used.
Maybe even like a physical demonstration, obviously with your clothes on, but you know, even that would be helpful.
Yeah. Thank you very much for your comment, Dr. Cantu.
I was going to comment that I really appreciated the comment of just taking off the wrapper, because that is just so important to someone who may not be familiar with it. Do I have the wrapper on it? Just so critical to think about the basics, not that we're trying to dumb down anything or in any way, but as you said, Melanie, everybody comes from a different context.
Yeah,
So,
and there is nothing
yeah, and for us as healthcare providers, it's better to start from that perspective rather than try to come in the middle or make any assumptions about their level of knowledge regarding a suppository or anything else. Yeah.
Awesome. So between you and Kendra, you have identified at least 3 techniques here. So Kendra mentioned asking him where he, what he knows about this topic. So if he had told her, oh yeah, I've been taking suppositories on a regular basis for some time, then maybe your follow-up with him would be different. If he had said he had never used one before, that would definitely be an indicator to go over everything. She also mentioned him showing her how he would insert it, of course not with his clothes on, and that would be our technique of teach back, which we talked about a few sessions ago. So if he, if she had asked if she had asked him to show her how he was going to take it at home, and he just, starts putting the packaged suppository, like she would have known, hey, like, well, actually you'll need to, take off the wrapper. So you can identify errors in the technique by asking them to do teach back. And then Adelita, you mentioned universal precautions. We can't assume that anybody has the same understanding. And so you just treat everybody with the most clear, plain instructions that you can, because even health professionals, we also need that and desire that, and so it's really across the board. And especially, I don't know what his issue was, why he was needing a suppository, but it's something that you are stressed out about. You're not maybe comprehending all the information at the time of the visit that you need to. And then the last thing I was going to say about this case, and this is true for so many of our health literacy issues, which is taking medications. That's the number one, Teresa would agree, the number one health literacy struggle that people have. Let's say Mr. R was not very comfortable with the clinic or the LVN. Well, he could always go, he has to pick up that suppository at a pharmacy. Let's say he's going to HEB pharmacy. They have pharmacists who can talk to you, answer your questions, who are maybe a little bit more at a community level for you. And, if you have any questions, or maybe he didn't think about the question until later, it's too late now to ask the provider because you're out of their office, but you can ask the pharmacist. So I personally love community pharmacists. For myself, I use my local HEB, And I have even called them up when I have questions about something that maybe I didn't even get from them. You know, it's okay. It could be about any medication, and they will actually put the pharmacist on the phone with you pretty quickly to answer your questions. So it's just another resource for people, especially in that medication area. Did anyone else have any other thoughts about techniques for using health literacy to make this a better experience?
Dr.
Can I
Rosenfeld?
say something? Oh,
Yes. Who is this person?
No,
Michelle De La
Michelle.
Rosa.
Hi, Michelle.
Oh, hi. So uh, there was a time I went to the hospital. I just want to share a little bit of my experience with. She was an amazing nurse, and I was one of those clients, for I guess patients that was I had severe anemia at the time, and so the nurse really demonstrated. How she opened the package, and she opened the box for me and showed me, because in the box it has a picture, demonstration on how to use the suppository, and she told me if I had any questions I can always call the Ask a Nurse hotline, and they can walk me through it. So she was a very patient nurse, and she was an angel. So, and at the time, when I was going through all that stress, like, I had to read it over and over because I wasn't understanding it, because there was a lot of interruptions in my mind. So, yeah, I feel like maybe demonstrate and ask it if the patient needs help with the reading, and just so that extra help. Some patients are embarrassed to say that they need help. Sometimes in the medical field, I noticed that we just have to go in and do extra explaining, because some of the patients won't tell us that they need help with the reading or the demonstrating, or they'll just take our box or our prescription and go home, and then like this gentleman, the accident happened where he didn't open the package. So I feel like in the medical field that we need, at least I do, I act like, or I treat them like they all need help, because sometimes they don't even remember, like, um what the nurse said once they go home and recover, because they're on so much medication, or they're still in that recovery state. So
Yeah.
definitely point out the hotline number, or if they have any questions, or even read, or maybe have a family there with them
Mhm.
for the instructions. I would definitely do something like that if it was me.
Great points, Michelle. You definitely have hit on what many of the scenarios are when we are in that healthcare setting. What you're describing is for that practice to be patient-centered care, where the focus is always number one on that patient. But you also mentioned a fourth technique today, a fourth health literacy technique, which is having a friend or family member with you. That is huge. And I can't tell you enough, especially when someone is hospitalized, you want to have someone there with you. And I know this from my insider knowledge of my friends who are nurses in hospitals. You want someone there to be your advocate, to help you remember what to do, and to be on the lookout for things that may not be going right. So you guys have done a great job of identifying many of our health literacy techniques in this. And I hope those two resources freely available to you can be useful in either your training and or advocacy work. Thank you.
Thank you, Dr. Stone. I also see a lot of empathy, right? Which is very, very important for all of us to have the person that is in front of us. And I see a lot of respect, which is a very good quality that we always need to cultivate ourselves. And as we promised with all the chat, I see Dr. Rosenthal says, start from a place of curiosity, find out what the person knows already about X procedure or X medication, and then build from there. Is there something else, Dr. Rosenthal, that you would like to add for this session?
No, it was said already.
Thank you very much, you all, to be with us. And this is the time that I would like to say a huge thanks for everybody. Dr. Wagner, thank you so much for this wonderful presentation. We learned a lot today. And Dr. Stone, thank you for the case. We always are learning something every day. As we'll build up those sessions, I encourage you, I invite you to come to our next session in 2 more weeks. I was checking the calendar, is going to be May 1st. Please come and join us. Put in your calendar. And for the continuing education credit, there's already information in the chat. Please click in the link. And for you all, thank you so much, and be part of this learning community. Have a wonderful rest of the day. Thank you so much for joining us.
Thank you. Have a great weekend.
Thank you so much, Kendra. Thank you for your participation.